So this is the CMS signature rule. So this is Center for Medicare and Medicaid Services. So again, all other insurances do follow suit. So please make sure you're following this on every single run. And you guys know the sections that I'm talking about. You have 3 different sections where somebody can sign. So the patient can sign, patient representative would be section 2, and then facility would be section 3. So we're going to go through when, where, how, why to use those. We'll talk about refusals, things like that. So we'll get through this pretty quickly. But if you have any questions, please just let us know. All right, so the first section is obviously getting the patient's signature. So just think of this like transaction of business. This is a legal document, so if the patient is able to legally sign, yes, we had a hand raised. Mackenzie? And I believe you're muted if you are trying to speak.
That was an accident, sorry.
No problem. All right. So the first one is going to be obviously get the patient's signature. And if they are able to sign and they, can transact business, then fantastic. Have them sign their document, and then you can go ahead and move on. It does say that all signatures must be legible, which we know is silly and a joke because even when we're signing on a computer or signing even, on some of those weird tablet things and, pieces of paper, it's going to look different than when we sign on, our normal signature. So we understand that sometimes it's not going to be legible, if you will. And if that is the case, and if it comes off looking, like squiggly or just a little bit wonky, maybe they signed with an X, there is going to be, you have a witness box. So just have somebody sign in that section. If there's somebody else around, fantastic, they can sign. But legally, you as the provider can sign as the witness. You're not taking any financial responsibility for the run. You're just signing to say that you see that the patient's trying to sign and it's looking a little bit wonky. That's all that signature means. So we had somebody ask if they could do this on every single run. Absolutely, it's not going to hurt anything. But yeah, we have seen it really help support those signatures. So if you do think that it's looking a little bit weird, please just have a witness sign or have you sign as the witness so that we can make sure that that is bolstered, okay? All right, so then there are going to be only 3 categorical reasons why a patient can't sign for themselves. Are we having accidental hand raises or do we have an actual question?
On your slide, it said that you're required to have the patient sign and put in their address.
No, so on this one, so this is a screenshot from ESO. And so it's not necessarily, this is not the patient's address. This is actually the witness's address. So they do require the witness's address. Keep in mind that if you are signing as a witness and it does ask for your address, just put the station address. You don't need to put your home address in there.
Okay, thank you.
No problem. Good question. All right. And then Mackenzie's hand is still up. Is that still just like a mistake or a?
Gosh bless, I'm sorry.
No, you're good. I just wanted to make sure. All right, perfect. So, all right, so then there's only 3 categorical reasons why a patient can't sign. This is a legal document, so a minor can't sign for themselves. We know that. Or if they're physically incapable or mentally incapable. So those 2 have a lot of drop downs or branches, if you will. So over the next 2 slides, we'll talk a little bit about those and some valid versus invalid reasons that we encounter. But whatever reason it is that you're giving, just remember that you guys are using your best discretion on every single run for every single thing that you do with your patients. It's the same thing for this. If there's some reason that you can determine why the patient shouldn't be signing or transacting business, then you're probably going to have some type of physical or mental incapability. And please just make sure that it matches the rest of your report. I know that sounds silly, but we see it all the time where it's like, 1 out of 2 toe pain and GCS of 15 and ANO times 4 and speaking in full clear sentences, and then it's half a mile to the hospital, but patient didn't sign because of altered mental status. And it's like, where did that come from? It doesn't match anything else that you put in your report. So please just make sure that any reason that you're giving does match the rest of your reporting. So here is a list of some reasons. This is obviously not an end-all be-all list, but these are just some categories of reasons that are valid that can be counted as, why the patient is unable to sign. So altered mental status is absolutely valid. It just needs to be supported by the rest of your documentation. ETOH is valid. Patient restrained by the police or otherwise. Great pain is a little bit different. Dustin, you want to speak on this a little bit?
Sure. I had a run that I audited a couple years ago where they said the patient was unable to sign due to 6 out of 10 foot pain. Sure, their foot probably hurt, but did it really prevent them from signing? Probably not. Just make sure the pain correlates if you're using it. Is it in their arm, their hand? Are they physically in too much pain to, use their hand to hold a pen or use their finger to sign their tablet? Is it pain from, maybe they're having a heart attack, they have chest pain, or whatever the, a traumatic injury where they, they shouldn't even be asked to transact business at that point. Just make sure that pain actually correlates if you're using it.
Absolutely. And then we had a couple hand raises. So Aaron, it looked like yours was the first one, maybe?
So my question, how do we determine if they actually have ETOH? I mean, we're not testing it. We're not testing their blood. We're not testing their breath.
Yeah, you can use that if they admit to it.
So only if they admit to being drunk or admit to being drinking?
If they're drinking and you see that they're altered and they tell you that they've had too many, you can use it as a reason. Obviously, you can't just make that assumption and use that on your report. But if you're observing it and they're telling you that, you can use that.
Okay.
And you don't have to, but I mean, again, it also came up, speaking of drinking, it did come up in one of the classes about, is that always going to be a valid reason? Because, maybe somebody drinking's legal. So you can have a couple beers and that person could still technically sign because they could still be, of sound mind and sign on their accord. So it's really, again, just using your best discretion. Do you think that patient is under the influence too much that they shouldn't be asked to transact business and sign off on a legal document? And if so, then that's where that comes into play of like, maybe, don't utilize, or maybe utilize that, or, patient, admittedly under the influence or whatever the case is. And then, all right. And then Brandon, you had raised your hand as well.
Yeah, it might be kind of a stupid question, but if somebody has, or let's say somebody's right-handed and they have an injury to their right hand, are we going to make them sign with their left, or do we just say that's a reason why they cannot sign?
Good question. It's actually been addressed by CMS. Have them attempt to do it with their left hand. If it comes off as just like a, chicken scratch or a mark or an X, that's when you would use that witness if it's not legible.
Okay, thank you.
But again, if let's say they have that injury to their hand and it's severe and they're, in distress, maybe you just say, due to whatever that injury is, they can't sign, depending on the severity and pain level.
Okay, and a lot of times they may refuse to do it with the left, and we would just put that in the narrative that they refuse to sign with the other hand, and that's the reason, or? Yeah,
like let's say you're at a construction site and someone accidentally, put a nail through their hand or something like that. If they couldn't sign with that hand, but maybe once you, get there and, assess them, stabilize them, they're all, they're good enough that they can sign with their left hand, that's fine. Maybe they have like a severe crush injury to their hand and they're in distress and they're in severe pain. That's one where you probably just make that judgment call. Should you even ask at that point?
Okay, thanks.
Yep.
And then in the notes, or in the chat, somebody did mention that if they are blowing for the police and that they are over the legal limit, then they should not be asked to sign, because then they can't legally sign because of, that's, so if they're over 0.08 or at 0.08. So that's a really good point too. Thank you for that, Matt.
Yeah, and then once you have that confirmation again, you could always use E2H, or you could just use altered mental status, whatever you're comfortable with.
Mm-hmm. Good questions, guys. Any other questions? Aaron, you had your hand raised?
Yeah. What if they get to the hospital and they refuse to sign, or they leave the hospital before they have signed your documents?
So if they refuse to sign, we'll talk about that here in a couple minutes. If you are working the patient all the way to the hospital, we'll talk about that one on the next slide. And if they, aren't able to, or if they, taken away, or you're saying that they actually just leave.
Are you talking about like if you
I
get there and they
genuinely had a
just,
patient that left the hospital before
Yeah.
any documents were signed. They didn't even get AMA paperwork. They were just like, nope, I'm gone, pulled off their stuff, got off the bed and left.
yeah, that'll still fall under the category of refusal.
Yeah.
As long as you made that handoff already, even if they haven't signed anything, we'll end up sending them a signature sheet, try to get that at a later date.
Yep. Yeah. So we'll talk about refusals here in like 2 slides or something. But good question. Any other questions? All right. So yeah, so legally blind, language barrier, quadriplegic, those are all valid reasons. Contamination is an interesting one because before the pandemic, this was not counted. If you guys remember, they did not allow for contamination to be a valid reason. Then once the pandemic hit, they were like, oh, okay, contamination might be a real thing. So now what they say is that it has to be a physical contaminant though. So you have to say, blood on the hands or feces on the hands or whatever the case is. Just say what that is, what that contaminant is. We have seen denials because of COVID here recently even. So even if the person is holding a positive COVID test, you still can't say contamination or use that because they're going to expect that you're already using your own PPE and you're protecting yourselves. So they're not counting that or flu or anything like that. Dustin, do you have anything to say?
Yeah, there's a specific allowance during the public health emergency for COVID patients. They allowed you to get verbal consent. As soon as the PHE ended, the allowances for COVID ended, and we've even seen crews try to use, flu or cold and stuff like that as reasons. Those are not valid reasons.
Yeah, so it has to be a physical contaminant now. So just make sure you're putting that on there, but then it is valid. But then the last one is just obviously like kind of your catch-all of anything else that you guys can determine based on using your best discretion that there's a reason. You can probably determine some other reason because obviously these are just a few examples. There's a million reasons why a patient can't sign. So if you just determine that the patient should not be asked to transact business, then let us know what that physical, mental, and capability is, and then that will count. So just be specific when it comes to those type of things so that we can make sure that it is on there. And then, yeah, any other questions? Getting into invalid reasons. This is obviously not an end-all be-all list either. These are just some things that we've encountered. So saying that the patient is old is not a valid reason. We actually see that way more than we should. But we have patients who are elderly and sometimes they're too they're too weak to hold a pen, or maybe they have tremors, or maybe they're altered, or whatever the case is. There's a lot of things that can happen with our elderly patients, but just saying patient is old is not a valid reason. It's not physical or mental incapability, so please don't use that. This next one, I had to include this because we were auditing and I saw this and I just laughed out loud. So if you guys know that Latin phrase in loco parentis, it means a person is assuming responsibility of a minor. This is just saying what it looks like is that the reason the patient's unable to sign is because they're a minor / locos parentos, and so they have crazy parents. So that's what it looks like they're saying. So please don't, if you're not smart enough to use Latin phrases, don't try to use Latin phrases. But really, if you have a patient who's a minor, just say that they're a minor. You don't have to use any type of in loco parentis, anything like that. You don't really need to do that. And it kind of goes back to, if you're called into court, you also don't want it to ever be, taken as you're making fun of the patient or anything like that. So don't ever, just leave those type of things out. Make it as simple as possible for you and make it valid reasons. All right, so we had a couple of questions that were coming through in the chat. You can refuse to sign if you're old, but you're still going to get a bill. Tremors due to Parkinson's, yeah, so tremors, absolutely, yeah, or yeah, ALS, anything like that. if you have any type of, if the patient is shaking and they're not able to, hold a pen or sign, then absolutely, those are valid reasons. Then moving on to weakness. Dustin, you want to talk about that one?
Yeah, same thing as pain. Just make sure you're describing the weakness. If you're just putting weakness or general weakness, the insurance company's not going to accept that. Now, if you have a patient that's so severely weak that they can't lift their arm to hold a pen or use their finger to sign your tablet, or whatever the case is, then just describe that, put that detail in there. If it's a patient that has a medical condition like ALS where they have muscle deterioration, provide that detail. Just tell us why they're too weak that they can't sign.
Mm-hmm. Yep. There's also, like, we encounter sometimes where our patients are alert and oriented. They could sign on their own accord based on your judgment, but they say, you know what, my spouse always signs for me, have them sign. Or I don't feel like signing, just have somebody else like the RN sign for me or something. Those are actually considered refusals. You can let them know that they need to be the one that signs, or you can just count it as a refusal and move on. And like I said, we'll talk about that on the next slide on how to handle refusals. Computer malfunction, you guys have this one covered because you already have paper signature sheets. So what we just always suggest is that if, we have some people who will say, yeah, my computer died, so I wasn't able to get the signatures. Obviously, that's not a physical or mental incapability of the patient. And so because of that, we can't count that. So just please let us know, what that is. But if you have, your paper signature, just upload that and then that will count. And then patient receiving treatment at hospital. Dustin, you want to take over this one?
Yeah, every once in a while we'll receive a run report where they say the patient unable to sign due to acuity of care or receiving treatment at a hospital or with nursing staff or something to that effect. Basically, you're saying you didn't have time to get the signature, which may be true. You may have a medical reason why you didn't have time to get that. If you're busy working that patient all the way to the hospital and they have to immediately take over at the hospital, what's that medical reason that prevented you from getting that signature before you arrived there or after you arrived there? Is that patient having a CVA or a STEMI and you're busy working them all the way? You can use that. You can say unable to sign due to STEMI. I mean, unable to sign due to stroke. Unable to sign due to traumatic injury. Just provide that physical or mental incapability that prevented you from having the time to get that signature. Does that make sense?
And then it was noted, don't forget that you can have them sign either on paper or electronically. Just know on the paper form, it is not in the EPCR. So yep, as long as you upload that, then we will get those and everything will be all good. We can make sure we bill it properly. But yeah, back to the point, just really quickly with the patient receiving treatment, we had a couple questions on this throughout the week. So just remember that, if you're saying, hey, we arrived at the hospital and the patient was immediately taken back. And so they immediately were, admitted. And so we didn't have the chance to get the signature. So just letting them, so then we always ask, okay, so what were you doing I guess, Dustin, you can explain it a little better, but it's, what were you doing in the truck in the back where you couldn't get the signature at that time?
Yeah. So like when they say that they didn't have time to get it because the nursing staff took over, I would say, well, why didn't you get it while you were transporting to the hospital? Well, I was busy working the patient. Why were you working the patient? Because they had a traumatic crush injury to their chest. I'm like, okay, well, that sounds like a great reason for the no-sig. Use that physical or mental incapability.
Yep. Is room 9 really bad, or what is?
Room 9 is the trauma room at U of L. The only things that really go back there is significant trauma or stroke.
Yeah. Oh yeah, that's fine. Just put, traumatic injury as your reason if you're going to
stroke or whatever it was. Yeah.
Yeah.
Yep. Just put that.
The insurance company is not going to understand unable to sign due to room 9. Like, put traumatic injury.
Yeah. And even if they wanted to take the time to look into it, they're not going to. So yeah, just make it as easy as possible for them to understand. All right. Good questions, guys. All right. If you think of anything else as we go through this, just let us know. Okay, so getting into a refusal. So if a patient's refusing to sign, all it means is that they're not allowing us to bill their insurance. We can't speak with a third party. We can't submit their information to insurance. So that's all that it means. That's all that signature means. So on this first one, yes, it does. You know, if it truly is a refusal, if a patient is alert and oriented and they are of their own accord, you determine that they could sign, but they are saying, you know, I'm refusing to sign that document, that's fine. You know, don't argue with them. Just say that the patient refused to sign in section 1 and then just transport them and move on with your day. You know, that's easy enough. The other thing, though, is to keep in mind that, you know, is it a true refusal? Is somebody truly alert and oriented and could sign on their own accord? Or maybe are they under the influence, you know, on drugs or alcohol or being combative or whatever it is, and maybe they shouldn't even be asked to transact business at that time. So maybe putting that physical or mental incapability is probably better than saying it's a true refusal, if that makes sense. Last thing, when you're talking about SORs and a patient refusing to be transported, please make sure that even though they are signing off on the form saying, you know, I'm refusing to be transported, and you know that there's a whole blurb saying, you know, all the risks that are associated and everything that happened with it, please just make sure that you are going to write something in the narrative about explaining all of that to the patient. So even though they're signing off on the form, and even though there's already a blurb in there that says that they understand all the risks that are associated, please also, again, make sure that you are mentioning in your narrative that you discussed all of the risks, including, you know, death with the patient, and that they understood and signed the document. Again, going back to some of the lawsuits that we're hearing about, this is one of informed consent and patients not understanding clearly what's going on. And then families are coming back and trying to sue, saying that they didn't really understand the risks, et cetera, et cetera. So we just want to make sure that you guys, again, are protected. So please make sure that you are, this has nothing really to do with billing. It truly just has to do with making sure that you guys are covered. So please make sure you're adding those into your narratives. All right. So if a patient is unable to sign because they are a minor, physically incapable or mentally incapable, the second section is going to be a patient representative. So a patient representative, what they say is it can be anyone with the patient's best interest in mind, but a couple things. You all, as the crew, cannot be a patient representative. So please don't try to sign in here. We have seen departments do that because you guys have a financial investment in here. This is also not where the receiving facility would sign. Please make sure that if you're having them sign, it would be in the third section. So section 2 is reserved just for people like spouse, power of attorney, legal guardian. It can even be like a neighbor if that person is over there checking on the patient and you know, maybe they see that the patient can't sign because of whatever physical or mental incapability, or they're minor, and you're just having them sign. If you read the fine print on there, you'll see that they're not taking financial responsibility for the run. They're just signing on behalf of the patient. A couple caveats with the patient representative, just to keep in mind. If you don't have a patient representative on scene, then great. You can move on to section 3, which we'll talk about on the next slide. Or if you arrive on scene and there's a bunch of looky-loos like at an MBA, don't feel like you need to go up to every single person and ask who they are to that patient. You can just go ahead and move on. And then the last point is, if you have noted that there is a patient representative on scene and the patient can't sign, the insurance company is going to expect that you get that patient representative signature. But there are some, you know, situations where this can be a conflict. So let me give you an example. You're called for chest pain. You state that the wife meets you at the door. She's a patient representative, where she leads you to the back where her husband is laying in the fetal position, clutching his chest, 8 out of 10 chest pain. Tears are rolling down his face. He's crying, thinking he's having a heart attack. She's crying, thinking her husband's having a heart attack. But is that the time to shove that tablet or computer in that woman's face because she's the patient representative and needs to sign for insurance purposes? No, not at all. So there is, in Medicare, they say that if a patient representative is unable or unwilling to sign, which includes being in distress, please note that and move on, or before you move on, please note it in your narrative, because that will get you out of having to get that patient representative signature so that we can make sure that we are not disturbing the families or, you know, adding any more trauma to their situation. All right, were there a couple things going on in the chat?
If the patient is in law enforcement custody, do we get to sign, and which section, 1, 2, or 3? If the patient is under arrest and they're, in custody, handcuffed, you can't sign as a representative because you have a financial investment in the transport. You can have the police officer sign as a representative for that patient if they're under arrest.
Who do you get to sign? Who do we get to sign?
Who do you get to sign? If there's no representative on scene, you're going to just wait until you get to the hospital and get the receiving facility. If the patient hasn't been, if they're not under arrest and they're not booked, they can still sign on their own behalf. If they're under arrest and they're handcuffed and they are unable to sign, then you would just move on to the receiving facility.
Aaron, I see that you're are you talking? You're muted if you are.
I'm talking out loud to myself. Don't worry about it. It's okay.
We had just touched on refusals on the previous section. If the patient refuses to sign, just move on, note the refusal, and we'll get that signature later. We'll send that patient a signature form. All right, I got Brandon raised his hand. You have a question?
Yeah, I was just going back to the refusal regarding to a patient in law enforcement custody.
Oh, I gotcha.
Yeah,
If the patient isn't able to sign for themselves because they're under arrest and they're handcuffed behind their back, that wouldn't necessarily be a refusal. You could just move on. If there's a representative, like a family member or someone else on scene that can sign for them, that's fine. If not, you would just move on to the receiving facility and get that. I wouldn't say that would be necessarily a refusal. If they're not under arrest, if they're just ID'd and the cops force them to go to the hospital or whatever the case may be, they can still sign for themselves in that situation.
We had an incident where a person was under arrest, wanted to go to the hospital, but the law enforcement officer was not going to let them go until they were booked and searched, and then they would take them to the hospital afterwards. So in that case, where would the law officer sign, and what would they be? Are they the representative at that point?
Did you assess the patient before?
Yeah, okay. we recommended the patient did go to the hospital. The officer refused to let us take the patient.
That's a bigger problem, I would think, at that point. But yeah, I mean, you can get that officer's signature. That's fine. If it's going to be an SOR, if you're not actually treating the patient, that's not getting billed to Medicare anyway. So that's not that big of a deal for billing purposes. I think your bigger issue at that point is just you're saying they should go to the hospital and the officer is saying no. That's kind of strange.
But I would say also when we're talking about somebody being in custody, so I know that there were a couple of scrunched faces when you said that, Dustin. So I just wanted to make sure we were reiterating. So if a patient is not under arrest, they technically can sign for themselves. Once they're under arrest, then they are obviously in custody. From my understanding, Dustin, and please, I guess, correct me if I'm wrong, but the officer can sign as the patient representative at that point, correct?
Yeah, if they're under arrest, sure. When I say if the patient is under ID or indefinite detention, when they haven't been read their Miranda rights and are under arrest, they can still sign on their own behalf at that point. Yeah, if they're under arrest, the officer can sign as patient rep.
Yeah, and then that's a good point. If that does happen, getting medical control involved as well as a supervisor or command shift.
For sure. Like if you think they should go and the officer's saying no, that's a different problem.
Yeah. That's pretty bonkers. But really good points. Does that help clear it up for you or?
Oh yeah, it does. Thank you.
All right, perfect. Good questions. All right, any other questions right now? All righty. So going on to section 3, so moving on from patient representative. So section 3 is going to be the facility or receiving facility signature. So this is going to be kind of your ace in the hole. You should always be able to get this signature. If the patient's unable to sign and there's no patient representative, then this is going to be the way that you go. You guys do a phenomenal job of getting full names, so full first names, full last names, and credentials along with their signature. So please keep that up, because all of that information is required. So please just make sure you're getting all of those. And then a lot of times it'll ask for your signature. And then there's also going to be the transfer of care signature too. Dustin, you want to point on that one?
Yeah, that has nothing to do with billing. You're just make sure that you're getting that transfer of care signature, just showing that proper handoff, just liability for liability purposes for you guys.
Yep. So what we've found is that if you are going to be, just based on your sheets that you have, if you are having the receiving facility sign on behalf of the patient, you're going to have them sign for that. And then you're also going to have them sign a second time as for the transfer care, so that you'll have two signatures from the receiving facility in that case. So just keep that in mind. All right. So moving on, you guys do a really great job of all your crew members signing. So please make sure that you just continue to do that. Anyone that is listed on the truck transporting into the hospital with the patient, please make sure that they are listed on that run report. Please make sure they're signing. Again, you guys do a really great job of this. The one thing that we need to make sure that we're working on is when we're talking about your roles. So it's my understanding that you guys choose maybe a couple roles at the beginning of your shift, and then it kind of automatically put it on there or something to that effect. Keep in mind that you're going to need to change your role every single run, because some runs you might be, and when we're talking about the driver, for example, it's the driver with the patient in the ambulance to the hospital. That's the driver that needs to be recorded. So even if you drive to the scene, if you're the lead, once you get there, then you need to be listed as the lead as opposed to the driver. So please make sure you're putting those type of things in there. But yeah, everybody has to have a role. So lead, driver, even students need to be listed on there, anybody else. But you can't have two drivers on each run. And what we've encountered is that there's multiple people being multiple things on the same run. Or maybe somebody's listed as an EMT as the lead, but there's ALS interventions being done. Obviously, those can't be billed because because obviously an EMT is not going to be performing the ALS interventions, right? So we need to just make sure that all of the roles are in there and chosen appropriately for each different run, please. All right. And I'll say that that's honestly the biggest challenge that we've encountered with your department. So that is saying something, because that is pretty good. That's the biggest challenge. So that's awesome. This is just showing that there are denials coming through. Okay, perfect. So there was an email that went through yesterday about filling out the roles. So thank you very much. But yeah, this is just a sample denial for, it was only for lack of provider information that they denied an entire run because a crew member didn't sign a document. So if that is the case, it does happen. They would ask you to sign an attestation form, but please just continue to do what you guys are doing and sign at the time of service. You guys are doing a great job at that. Last thing, crew certifications. So when you are in your report, if you go to print, on the print preview, on the last page, it will show you your name, and then it'll have your PSID next to your name. Please always make sure that your PSID is obviously valid and make sure that it's on there. If you have a new expiration date, once you get your new expiration date when you're recertifying, please make sure your new expiration dates are being uploaded into Zoll and the PMS system. The other thing, and this is just a PSA, is please make sure you're getting your continuing education in early for your recertifications. The state is backed up. They are just like anybody else. I think they are short-staffed right now. So please make sure that you're getting that in early, because we have seen it happen so many times in the last 2 years where somebody thinks that they're good to go. They've submitted their continuing education, and then come to find out they're being audited. They're not paying attention. So they're jumping on the truck and they're working with patients and all of that. All of those runs are going to have to be refunded. And then also in this down here, you can see this was from November. This is from the Office of Inspector General. So TransCare is in Indiana, and this happened where they had one person have this exact situation. They were unlicensed, and then they had to pay over $200,000 in penalties just for that one person being unlicensed, because they thought that they had recertified and they didn't update their information. So they had to have those penalties, plus they had to have the refunds, plus think about the liability for the department, plus think about the liability for you as a provider. So please just make sure you're getting that in early so that you can make sure that you're good to go and you don't have to worry about it. If you do get audited, you won't have to miss shifts or anything like that. All right. Any questions with this? There were a couple things. Okay, so yeah, anything that it sounds like you guys have. Okay, perfect. All right. So just to recap really quickly, Section 1 is getting the patient's signature. If the patient is unable to sign because they're a minor, physically incapable or mentally incapable, it matches the rest of your report. Just put that Y on there and move on to Section 2, which is a patient representative. If there's no patient representative around or they're unable, unwilling, or in distress, just note that and move on to the facility. Get that receiving facility signature with their full name and their credentials along with their signature. And then always just make sure you have those crew signatures, make sure you have your PSIDs valid and, updating your continuing education early, and then get those hospital face sheets as applicable. All right, we are at the end of this. So yeah, what kind of questions do you guys have?
So when it says credentials, do we have to put our PSID number, or can we just put like EMT basic?
So your credentials will automatically populate. So it will automatically populate on your report. So I know that previously it sounds like you were having to put your credentials into the narrative. You don't have to do that.
I was more referring to on the paper when you sign it and it says credentials. I normally just sign it, print my name, and then put my PSID number on the sheet.
Is that on the paper sheets?
Yes. Is that sufficient, or should I be adding EMT at the basic level?
I would say if you are using the paper sheets, yeah, just put your level, not necessarily a PSID. That PSID is auto-populating on the run report, so you should be good there. But yeah, if you say you're EMT or a paramedic, I would put that on the paper sheet.
Does the buyer have any questions?
No, I'm good. Thank you.
Okay.
All right.
Yep. Any other questions? All right. Well, we'll stay on here for a few minutes. If you guys do have any questions, just let us know. Otherwise, we really appreciate your time today. Have a wonderful rest of your day and stay safe out there.
Thank you.
Thank you.
Thanks, guys.
Thanks, Carmen. Carmen, I have a question. Once anybody else gets their questions answered,
Okay.
I have a question. So I guess there's no other questions for anybody else. So about the recording, when you get that done, can you somehow let me know how I can get a hold of that?
Yep, we will email it over to you.
Okay.
It'll come over in a Google Drive link. It'll
Right.
be too big to go through the email itself, but
Right.
then you'll be able to access it. It'll take probably about an hour to finalize and buffer before it'll be available.
Yeah, that's fine. So I did have one other question regarding, and this is a question that I asked in one of the live sessions this week, and I'm still not sure I understand what we need to do with this. So with students, so right now, unless the student is an employee of ours, they're not in the run, their name is not in the run report system, is not in Zoll. So sure. When we have students on the truck that are not, I guess this is a two-phase question. If we have students on the truck that are not our employees, do we somehow need to get their name? Do we need to put their name into Zoll so that we can actually put their name and their credentials on there?
Yes.
Yep.
Yeah,
Okay.
because we've seen that in audit situations here recently, where there was this one department that had, I think it was like 40 different students, and then they were scrambling to try to go because they weren't their employees, and then they may not even have access to them later on,
Yeah,
and
they had
they
to go back
missed
to the
signatures
actual
and things
school
like
they
that.
came from to get attestation forms filled out with their information.
Yeah, so you don't want to have to deal with that.
Does Zoll have an option to add another crew member where you can manually type in the information at the time of the run? I know other EPCRs do. I just don't know about Zoll.
That's possible, but it's easier. It's something that, like at the beginning of the shift, it would be easier for them to do it when the crew is putting their names on there. It would be easier to put the student's name on there as well, rather than doing it, because I think otherwise they'd have to do it on each run.
So another thing that you could do is you could just preemptively, we can send you that copy of that attestation form. You can preemptively just use that anytime you have a student and just have them fill out that paper form and then just include it with the documentation if that's easier as well.
Okay, all right. The other kind of related question is, and this is a question I asked this week too, and again, I'm not clear on your answer. So with our people who are employees, when they are a student, either in an advanced EMT or paramedic class, and they're on the truck as a student, if they're put on there, if we use their name as it is in Zoll, then they're going to get those like an EMT, let's say with a paramedic class. It's going to show their credentials as an EMT, but yet it's going to also show that they're doing procedures or interventions that an EMT would not normally do. They're going to be doing paramedic level interventions as a student. Is that a problem either on the billing side? I've always had concerns with that on the liability side, but is that a problem, any problem on the billing side?
Is there a way to label them as a paramedic student as opposed to just showing up as an EMT?
I believe their name would have to be duplicated, would have to be put in again with new credentials.
Okay. Could you just have, if that's ever the case, could you have the crew member just make a note at the bottom of the narrative that such and such is a paramedic student? As long as there's a notation on there that we know. Because I mean, if that EMT or advanced EMT is, trained to become a paramedic and you meet the crew requirements for that training crew, and they're obviously practicing under that paramedic's license, as long as we know that's happening, then we're going to bill it accordingly. We just need some kind of indicator showing that, or letting us know that that person is currently training to become a paramedic.
So that can be added in like to the end of the narrative.
Yes. Yeah.
Okay.
Yeah, just some kind of indicator so that we know, or whoever reads that run report at some point in time knows.
Okay. I think that answers my questions.
Awesome. Is there anything else that we can do for you before we get off here?
I don't think so. Thanks a lot. I appreciate your time this week.
Not a problem. Anytime. I will get this recording over to you as soon as it finishes.
Okay, great. Thank you.
Thanks. Bye.